This is med cart.
Ooh.
And our patient will be, if you're up here, you'll have a patient there. We'll have 4 sections going at the same time, okay? Each instructor will be teaching or checking off their own students. There'll be a patient set up here, back in that corner, and up here, okay? So, med cart says med cart, room number will be posted on the curtain. It will be pulled, okay? You will knock on the door, just like as if it were a real patient room. All right, so you come in, you hand me your urosepsis care mat, because that's what you're going to turn in before your CCE. And I'm going to say, okay, it's time for you to start your morning meds. You just came on shift, so go ahead and give your morning med pass. Okay, so that will be my med dispensary. And I am giving meds for Fred Jones. This is Fred Jones, and I see his orders are for Fred Jones. This is his chart, and these are his medications. So the first med I'm going to give is a nitro patch, 0.4 milligrams, and it's topical, and it's due at 9 o'clock, and I'm giving the morning meds. So it is the right drug, the right dose, the right time, and the right route. This is nitro patch, 0.4 milligrams per hour. First check. Trazodone, hydrochloride, 150 milligram tab, and I'm going to give 75 milligrams. And this is trazodone, 150 milligram, and I'm giving 75 milligrams, so I will give half of this tablet. Okay, and it's PO. That's the right dose, the right route, and the right time. Fluticasone. It's Flovent. Can't say it, sorry. Flovent, 44 micrograms per inhalation. Flovent, 44 micrograms per inhalation. I'm going to give 2 inhalations, okay? And it's, due at 9 o'clock. So it's the right dose, the right time, right route, right drug. The 5 rights, right patient. Okay? And then I have phenylethylamine. Oh, that's due at 2 o'clock. I don't have to give that. Okay. And that one's due at 12, so I don't have to give that. Oh, you said my patient's having pain? Oh, and it's an 8 out of 10 in the abdomen. Okay. Let me see what we have then.
Are they going to tell us this? Are they going to say the patient is pain?
Your instructor will come up to you and tell you that. Okay, so under PRN medications for pain, I have meperidine, 75 milligrams per ml injection, and I'm going to give 75 milligrams every 3 to 4 hours. I am PRN for pain. Now I need to see, has he had it recently? No, he hasn't. So it is the right time. It is the right drug. The right route is IM. And the right dose is 75 milligrams. So I look at my bottle that I have available, and lo and behold, it's Demerol, 75 milligrams per milliliter. So I do my figuring, okay, and I'm going to give 1 ml. Okay, so that's the first check. Now I'm going to set up my medicines, and I'm going to choose a needle. Oh, and I drew the ventricule. So I need a 1.5-inch needle, and this is it. Okay, there's my needle. I need my cotton swab. I need my alcohol. I need 2 alcohols and a cotton swab. Okay, and I need a peel cup. There's my peel cup. For practice sake, I've got to give an eye drop. And it's going to be 2 drops to the right, 1 drop to both eyes. And ear drop will be 2 drops to the right ear. And I have my little peel cup, which I don't have in here.
You're so cute.
some back there? Can I have that one? Thank you. There'll be pill cups available on your table. Okay, so I have my pill cup. Okay. I'm gonna put this back in here just to get it out of my way. Okay, for my second check, I have my med cart here. My second check. Okay, I'm giving my nitroglycerin patch. Right pat and time. The dose is 0.4 milligrams, 0.4 milligrams per hour. The time is 9 o'clock, and it is topical. I'm giving trazodone 150 milligram tab, and my dose is 75 milligrams PO. This is 150 milligram tab. My dose is 75 milligrams PO, so I would break that in half. So that's it, and it's the right time. We have the Flovent inhaler, 44 mics per inhalation. I'm going to give 2 inhalations, and it's 9 o'clock. It's the right time. And I'm going to give this eye drop, 1 drop in both eyes. It is the right time, and it is an eye drop. And this is my ear drop, and I'm going to give 2 drops in the right ear. 2 drops, and it's the ear drop. Okay, so I'm going to give that. Now, and I'm also going to give Demerol, and I'm going to give 1 milliliter of Demerol, which is 75 milligrams, and it can be given every 3 to 4 hours PRN, IM, and I see it has not been administered yet, so it is the right time, the right drug, the right dose, the right route, and this is for the right patient. So I'm going to take my chart, and what did I forget?
Allergies.
Hand hygiene.
Oh, whoops.
So I would have done my hand hygiene first.
When you say that you do the veteran deal, is there gonna be like a bucket that we?
Now, there'll be cards, there'll be 3 cards, deltoid, ventral gluteal, and vastus lateralis. You won't be able to see what's on it, and then we'll hold them out like a little deck of cards, and you'll just pick one. So, oh good, this needle's already connected, but I'm gonna verify it's snug. Okay, and I cleaned it, and I waited for it to dry. And I'm giving 1 ml. Okay, 1 ml. Let me get the bubbles out. Okay. Trouble. Still got a big bubble. You see, you have to pull your needle down below the level of the foot. Okay. One-handed scoop method, recap the needle. Show your instructor. Okay, no bubbles. 1 ml, they looked at your calculations, it's correct. Okay, so that's ready. Alcohol prep. And a Band-Aid, which I know. So we'll pretend this is a Band-Aid. Okay. And by the way, the doctor's ordered a Foley catheter for your patient. Might as well take it with you when you go. Okay, I'll take my Foley. Here's my Foley.
Looks sterile.
There's my kit. It's all in this kit. Okay, y'all just have to use your imagination. Okay, so now I'm ready to go to my patient's room. I'm going over here. Okay. Do you use a room number as an identifier? No, you do not. Okay. So you come up to your patient's room where the curtain will be closed, and you knock, 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 knock. Hello, Mr. Jones. Hi, my name is Debbie, and I'm going to be your nurse today, and I'm going to give you your medications. I understand you're having some pain this morning. Is that right? Okay. Can you rate it for me on a scale of 0 to 10? It's a 9? Okay, your belly? Okay. I'm going to go ahead and give you something for that pain, okay? I'm going to raise your head up a little bit. Should be laying so flat. Can you hand me the bat? Y'all will be using these for your demonstration, and it will be available. Thank you. Okay. Okay, Mr. Jones, I'm gonna have you turn up on your side just a little bit, 'cause I'm gonna give you this in your hip area, okay? All right, I wanna give you your pain medicine first, because you might be getting sick at your stomach. I don't want you throwing up your medicine, okay? All right, so I'm gonna wash my hands, okay? I'm gonna put on my gloves. There's my gloves on. Okay, so I have your medicine, and I'm gonna check it again. Okay, your doctor's ordered for you to have Demerol, 75 milligrams, and it's got to be in your muscles, so I'm gonna put it right here, okay? All right, sweetie. So I have your medicine, and I figured it up. It's 1 milliliter per 75 mLs. And I'm going to give it to you in your ventrogluteal area. So I'm going to find the site. Okay, I'm going to give it right there. And I do have on gloves, by the way. And I'm going to clean the site vigorously, 30 seconds. I'm going to point my alcohol prep to my site so I don't lose sight of my site. I like that.
Can you do it for 30 seconds or we just verbalize it?
And verbalize. We don't have time for 30 seconds. Okay. Now, have my injection. I do Z-Track method. Insert at a 90-degree angle. And I slowly inject 1 ml over 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I pull the needle out and let go of the skin. Check for bleeding. Apply pressure if needed, if there's any bleeding. And a Band-Aid if needed. And there is none. That's wonderful. My safety. And I place it in the sharps box. Okay. Okay, now I'm going to let you lay there for just a little bit till I get to feeling better. And I'll be back in 30 minutes and check you, okay? Okay, 30 minutes has passed and I've come back. And now, hello, Mr. Jones, are you feeling better now? What's your pain level now? A 2? Okay, is that acceptable to you? Okay, good. All right, I'm going to go ahead and get your medicines ready. I left my pill cup at my med station. So I need to go get that. I'll be right back. Gloves off. This will happen. Yeah, wash your hands. Come back. Oh, now I have your pill cup. Okay, I have got to wash my hands again. Put my gloves on. Don't forget your pill cup. We'll prompt you. Okay. Okay. So now it's time for your medicines. And I have a nitroglycerin patch for you. Okay, that's going to help with that blood pressure. Okay, because you've been having a blood pressure issue and that's why you're getting this. It also helps to dilate the blood vessels in your heart so that you don't have that angina that you have occasionally. Okay, and it's 4 milligrams per hour. 4 milligrams per hour is due at 9 o'clock. Oh, what did I forget to do?
Identifier.
Hello, Mr. Jones. Can you give me your first name? Okay, and what's your date of birth? Okay. Now, trazodone, 150 milligrams. 75 milligrams twice a day. I'm going to give you this half capsule. Normally at home, this is what you take, right? Okay. So, I'm going to go ahead and put it in the cup. And it would be half capsule, and I would break it, but I'm not going to because I don't want to mess with our system we have going on here. Okay? Now on the nitroglycerin patch, I'm not going to open it either. You would write the date and time on it and your initials. You would check to see if you have any other nitroglycerin patches in place. Remove them. Cleanse the site. I'm going to stitch you up a little bit so I can give you your medicines. Have a cup of water. If you need a fresh cup of water. Let me check your puffer. Okay, you get this flow vent puffer. It's 44 micrograms per puff. And I'm going to give you 2 of these puffs, but we have to wait in between them, okay? All right, so we're going to give you puffs. I'm going to give you this is your eardrops. And you're going to get, where is it? Let me find it again. Okay, it's the neomycin. And you're going to get 2 drops in the right ear. And it is due now. and it is the neomycin suspension 8. Okay. So I'm going to put that in, and I'm going to give you these eye drops, and you're going to get 1 drop in both eyes, okay? And it's a 2.5 solution, and this is a 2.5 solution, and it is due at this present time. Okay, so we've done our patient checks, this is our 3rd check. All right, so let's first take your first inhalation, okay? Let me shake up your inhaler. Now what I'm going to do, Mr. Jones, is hold your inhaler about 2 inches from your mouth, and when I press down on the canister, I want you to take a good deep breath in and hold it for about 10 seconds, okay? Oh, first thing, let me prime it just a little bit, okay? Okay, good, it's good. All right, are we ready? Okay, take a deep breath. Hold it for 10 seconds. Okay. All right, now I've got some water here, and I'm going to give you your pill. Okay, so let's take your pill. Ready? Okay, and here's your water. That'll be helping you to rinse your mouth out too.
Do you have them spit
Okay.
before you swallow the pill so they don't get the thrush?
It's going to go into their stomach.
Okay.
I don't see that it matters on that. Okay, because it's going to rinse their mouth out. You could if you want to have them rinse their mouth out and spit. That's fine too. So you would need a nemesis basin with you. Okay, you're all going to have an inhaler. So work it out the way, because we're fixing to give another inhalation here in a minute. Okay, so I've given the pill and I've checked for swallowing. Okay, that go down okay? All right, let's go ahead and do your eye drop now. Okay, I have a tissue. May I have a tissue? Okay. These will be available too for you. Okay. All right, so put your eye drop in. Okay, and it was in both eyes. So I'm going to put it in both eyes. Hold your eye up, and I'm going to drop it in the center of the conjunctival sac. Okay, and I'm going to do the other one in the almost dropped it really, in the conjunctival sac. And then I'm going to wipe the excess from inner to outer. I'm going to use a second Kleenex on the second one and wipe it from inner to outer. Not hard, because you don't want to wipe it all out. Okay, is that better? All right, good. All right, now I'm getting ready to give you your second puff. Again, I'm going to hold it 2 inches from your mouth, and I want you to take a good deep breath when I press down on the canister, okay? Hold it for 10 seconds, okay? You don't have to prime it the second time. It's already primed. Okay, hold it. Okay, good. Very good. Now, let's go ahead and rinse your mouth out. And you can spit in this little cup. Spit. Okay, good deal. Now, it's time for your eardrops. Okay, let's lay back. I need to give you your eardrops. Now, after I put that drop in your ear, Mr. Jones, you're going to have to lay on your side for just a little bit, okay? 5 to 10 minutes. Keep your head turned. Okay? That's good. I'm going to raise you up just a tad. It's hard to get to you. Okay, now let me double check on your eardrop. Eardrop is 2 drops to the right ear. Okay, we're going to warm this up a little bit, because I want it to be body temperature or room temperature. I want it to be warmer. Okay, don't want it to be cold. Turn your head. Turn your head. He won't turn his head. Okay. Okay, here we go. I'm going to pull up and back on your ear. Oh, that pulled his skull off. Jeez. Okay. And 2 drops. Drop. Drop. Okay. Okay. I need you to lay like that for about 5 to 10 minutes, okay? All right. Here's your call light. Can I get anything else for you? You don't need anything? Okay. I'm going to put your bed back down. I'll be back in a little bit and check on you, okay? Oh, what did I forget? Nitroglycerin patch. I laid it over there. Okay, so I did check. Still laying on his back, I can still put it on him. There's a patch. Okay. That's what happened when I laid it across there and didn't open it. I forgot about it. I would normally open it and have it ready to go on. I forgot about it.
You put the patch on his chest.
Mm-hmm. Nitroglycerin usually goes to the chest wall, It can be used also on the feet. It helps to improve circulation because it dilates blood vessels. So it can be used on the feet too. Okay, so I'm gone for just a little bit. And I come back because the doctor has now ordered him to have a Foley catheter. Okay? Because he has congestive heart failure. Okay. All that water I've been getting. Okay. Mr. Jones? Hi, it's Debbie again. Now the doctor's ordered for you to have a Foley catheter. Okay? What's that? Oh, that's a little tube that goes into your bladder to drain your urine so that we can monitor your output a lot closer since you have a little congestive heart failure. Okay? Have you had one before? Oh, you have. So you know what I'm talking about. Okay, that's good. I'm going to raise your bed up. Okay, let me get you up here. And I would not have my hair hanging down in front of me. It would be up, okay? Let me put this down. I'm going to wash my hands. And I, personally, would probably put on a pair of gloves before I touch the bed or anything around him. Okay? Okay, sweetie, I'm going to shut the door and provide privacy, okay? Because I have to expose you, okay? All right. So pull the door shut. Y'all ain't watching. Okay, get your call line out of the way. Now, I pull the sheets completely off their feet because I don't want them to kick it anywhere, to kick them. And here we go. I'm going to expose you now. Mr. Jones.
With the breasts.
Mr. Jones with the breast, yes. And what is this? That must be a Penrose drain. Okay. Okay, Mr. Jones, so I'll pull this out. This bag would have been around my catheter. I'm going to show you what I would do, and this helps you guys out if you do this way. You can use this bag as a trash bag. If you sit it here, you're not going to cross your sterile field with those dirty cotton balls. This is like a mess.
It's pretty.
It is not. This is a mess. How am I supposed to get that out? What'd you put? Duct tape on it? Okay, so I'm going to decide to open my catheter between my patient's legs, so I am not moving it from here to here. And it is okay. If you want to open it here and then move it over here, that's an extra step if you want to do that. I have no problems with that as long as you maintain sterile technique, okay? Now, my hands are clean. I would probably wash them again just because I'm freaky. Okay, so you open away from you first, okay? Then you're going to fold out your sides. Okay? You can use this if you want. I don't. And then I'm going to take my gloves. I'm going to quit talking because I don't want to forget something. If I'm talking, I'll forget something. So just watch. And if you see me do something wrong, interrupt me. It's sterile. That's sterile. This glove's sterile.